Hello again, my name's Gabe Zolna. One of my viewers sent me a message in regard to the video that I posted where I talked about the bronze plan. And she said she has the bronze plan and her deductible is, I believe, $6,700. So it appears that depending on the insurance company that you're with, they can change the deductible so that $4,000 number that I threw at you might not necessarily be at all accurate. You know what this really amounts to? It amounts to a death panel, not just for the elderly, as Sarah Palin had surmised. It amounts to a death panel for millions of people that cannot afford to get the health care that they need. Having Obamacare and not being able to pay the copay or the deductible is not having insurance. I mean, that's really what it boils down to. The woman that sent me that information said that she cannot afford to go to the doctor. And that's just one person. A lot of these folks have no clue. They get their Obamacare and then they realize it does them no good. So what's the point in providing unaffordable health care? I think they chose a name, the Affordable Health Care Plan, as a joke because they knew it was out of reach of most people. Each one of the four plans, you start off with a 40% copay, 30%, 20%, and 10%. And each one of those has a different deductible. Obviously, the 10% has the lowest deductible. The other problem people are finding is that a lot of doctors won't accept the insurance. You sort of can't blame them. And as I had said, what Obama's waiting for is to get millions of people on this farce of a program, and then it'll collapse because, once again, for the 20th or 30th time, there is no back end. You can't account for anything. You can't reconcile anything. They don't even know who paid their premiums. They have no clue. Another problem is that people don't tell the truth as far as the amount that they receive in subsidies based on their income. And a lot of people that are self-employed lie about their income. And they have, from the beginning of time, lied about their income. So the whole thing is really built on a house of cards. Anyway, you'll see. Single payer. And when it goes to single payer, it's not going to be pretty. Sarah Palin said there's death panels for the elderly. Well, there's going to be death panels for a whole lot of folks. And the reason that is the government will determine who gets what kind of service and at what cost. You'll have no option. There'll be no Blue Cross. There'll be no Aetna. There'll be no Humana. There'll just be the federal government. That, my friends, will not be pretty for anyone. What creates lower prices is competition. What do you think's going to happen when there is no competition? Give that some consideration. I told you what I think. My viewers are telling me what they think. And that's all a good thing. It doesn't work. The software is incomplete after $2 billion. Talk about corruption. Totally insane. That's what I think.